you have hired that person to work for you. And if they're not doing the job, they need to be fired.
Yeah, I agree.
Honestly. Thank you so much for listening to this episode of Earrings Off. We want to invite you to subscribe, rate, and leave us a review. You can find us on Facebook at Earrings Off Podcast and on Instagram at The Earrings Off Podcast.
Welcome to Earrings Off. I'm Lou.
And I'm Teresa. Let's get started.
Hey, lady, how are you? Listen.
John. Okay.
You know what? I know how you are about TikTok, so I didn't send this or try to share this with you. But, we've been talking so much about healthcare, particularly how challenging it is for us as Black women. We had our discussion with Stephanie Spencer, and then we followed that up with the two nurse practitioners who talked with us about heart disease. And so we've been on that talking about how the healthcare professionals, we can see them now as the new police for us in our lives in terms of how we're treated and the disparities. But Teresa, I saw this video on TikTok where this Black female, I wrote it down so I could share it with you. She started by saying that she has never been interrupted so many times in her life. She's never felt more like a number. And she just repeated over and over, healthcare is not for the Black woman. Healthcare is not for us. Healthcare is not for us. It's not for us. It's not for us. And you could tell she was emotional and she got teary at the end. And when she said oncologist, of course, I'm thinking cancer.
Yeah.
And, I when I saw that, it just confirms not that we needed confirmation, what you and I talk about a lot, even on a personal level, when we talk about what we're dealing with in all different facets of our lives. And
and I was going to say just that it's not in those targeted health conversations that this comes up. It comes up organically in just every day. It's a real issue. It is a real issue, and you have to be able to advocate for yourself. And even in some cases, like this young lady said, she couldn't even get it out. She was interrupted.
Right.
I mean, she couldn't even tell them how she was feeling. Right. She couldn't tell them what her symptoms were because that particular doctor didn't care that day. All they cared was about the 5 or so minutes that they were going to spend with her and, get on to the next patient,
Yeah.
It's
It's the training, it's the cultural differences, but it's also the healthcare industry. Just what you said, the amount of time that they're allotting for physicians to interact with these patients, and the fact that they have so many stringent protocols that they're trying to follow. And then when you look at that, and then look at our race, we're the ones getting the short end of the stick. Every time.
I was going to say kind of pump the brakes on that, because even with that limitation or those regulations and those rules, other people still get better care than us.
Yeah.
So I don't know that that's it.
Yeah. Oh no, that's not all.
I don't know that's it.
Yeah. But what I'm saying is that happens. And then just like with everything else, we get the short end of the stick. That's just like when an officer stops someone. You get different results based on the race, but again, we're in a very disadvantaged position in interactions that we should not be. That's my point with that.
Mm-hmm.
But
Mm-hmm.
just for example, you and I just listened to a panel discussion on the COVID-19 vaccinations. And as African Americans, you and I have covered that about talking about the impact of COVID in our community and the fact that we're more at risk, the fact that our numbers are higher in terms of hospitalizations and deaths. But there is a distrust for us of the healthcare system, born from years ago, all of the different instances that we know about and personally that we've experienced. So there is a reluctance in the Black community. There's concern with this vaccine. So the fact that our church was able to put together a panel of physicians that are in our church that we see and that we trust, that for me personally, that went a long way in explaining what to expect, where we are, and the fact that we need to get this vaccine. So that's the difference.
Yeah, well, I have attended many of those and I still see it as, and I'm going to get the vaccine. It makes sense to get the vaccine. I feel that I don't have a choice to not to get the vaccine, but I feel like this whole, I don't want to call it dog and pony show, but there's a lot of attention being put on Black people and this vaccine from a lot of different places.
Yeah.
And somehow we're being targeted, but we're not the ones. Sure, we're the ones who are getting sicker and we are dying, right? In large numbers. But we're still the minority, right? And if we all get the vaccine, it still won't have the herd immunity impact. It won't, because the majority needs to get the shot and they're not getting it.
Well, and
they aren't.
Yeah.
They're not taking it. They have the same concerns as we do. So that's what I mean. That's what you're hearing when it comes to that. It's just a lot of targeted. I think, we're all focused on that. Let's just talk about that distrust and why that is. Let's put the same kind of focus on that conversation. Let's put the target on the fact that Black women are treated so terribly by the healthcare. Because in that same presentation, we were that the statistics show that Black women are treated worse than anybody else when it comes to their experiences with healthcare is worse than anyone else on a greater percentage, on the greatest percentage. With the greatest percentage. But so that's what you hear. It's just, I don't understand it. I don't understand the need, or maybe it's because, it's like when you see something like that, or you read something, you see that over and over and over again because your attention is brought to it. But I have been in many, many webinars about this shot given by both the with a minority focus and a majority focus, or just a general focus. But in every one of them, they talk about they've focused at some point, either in the case of ones targeted for Black people, all, or the ones not targeted for Black people, some time, trying to get us to take that vaccine.
Yeah. Well, and see, now
I agree with the technology. Let me just get that cleared out. I do agree that if we should take the vaccine, because it is definitely better than getting the virus.
Well, that's what I was about to say, Teresa, that
Without
I hear you. Yeah, I hear you. But at this point, I don't know if, we have the luxury right now to debate that issue when we know we have to, try to protect ourselves
It's
and do
always
our part.
something. It's
Yeah. Oh
always
yeah.
something.
Yeah. 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 I hear you. I hear you. And folks, this is coming from us. And I mean, full disclosure, I don't even take a flu shot because that's just my personal decision. And so this was a very hard decision for me. It's a difficult one. When we talk about the fact, Teresa, you're right that there's been such an emphasis placed on making sure we hear the presentations, that there is a big push for us to get vaccinated as African Americans. And you're right, when we're in the minority, and that may not get us where we need to be in terms of herd immunity, but that just makes me think about what we started off with. The reason that's such an issue is because of the distrust. And so what we're seeing is compounded by the fact that we oftentimes don't have access to medical care, that we talked about that during one episode, the fact that we're at more risk because of many times we don't have access to fresh foods. That's a challenge for us. The communities where we live, we may be the fact that there are food deserts, and that can impact our overall health in terms of nutrition. And so then when you think about we don't have access to the health care, and then because of economic factors, it can be lack of insurance, but if we maneuver that, if we get over those obstacles and we get in front of a health care professional that doesn't look like us, doesn't understand our culture, doesn't respect who we are, then we're dismissed. And so when you're in an interaction with someone and you're treated as less than and you're not respected, it's very hard, even if you have cancer and you know how important this is, for you not to be impacted by that dismissal. So then, are you really hearing the information? Are you really following what you're being told when you don't trust it because of the way you're being treated? That is that's a hard spot to be in. And of course, everybody knows, okay, well, just go to Black doctors. But and certainly we support that, and you won't many times get that kind of experience. But when you are trying to find specialists and to manage certain conditions, that sometimes gets harder and harder, and that too is a challenge. So
you lumped a whole lot of things in there.
Well, I always
they're
do.
each their own. They're each their own. If I'm remembering correctly, you started out talking about food deserts and what the lack of good nutrition does to your health, and then the lack of insurance, and how that can impact health. And then you said something like, when you do get in front of a doctor. See, to me, those are three different major issues, and you can't talk about them in the same conversation, really, because then you lose sight of one or the other, right?
Yeah.
So so I want to just stick on the one right now about when you do see a doctor. When you see a doctor and how we're treated, I think that has to be, especially for Black women, that needs to be talked about as loudly as Black Lives Matter, in my opinion. Because what I'm learning every day is how bad it really is, and how many of us are dying unnecessarily.
I know,
because
Teresa.
we are not getting, I'm talking about women who have insurance, who are seeing doctors, and they're still dying because they're not being treated because of their skin color and the fact that they're a woman. So that is something that I'm just shocked to find out. I had no idea, and I'm ashamed that I didn't know. But we need people to understand that this is an issue, and that if you are feeling that way, you're not alone. You are not alone. Do your research, Google it. It is a real thing, and we need to talk about it. We need to shout it from the rooftops, and we
Well,
need to make women aware. We need to make women aware that when they do go to the doctor, they make sure that they go with a checklist and a
yeah,
communication plan, as one of our speakers have told us about. And they need to stick to the script, stick to their script, and realize, as another of our speakers told us, that you are the CEO,
yeah, that's
and
what I was about to
that
say.
you have hired that person. You have hired that person to work for you. And
Yeah,
if they're not doing the job, they need to be fired.
yeah, I agree.
Honestly.
Yeah,
And
that was the
and
point.
so we have to approach it. We have to approach it from our own. We have to take ownership of that and
Absolutely.
make them listen to us. And if they don't listen, then you need to move on. And it doesn't matter, honestly. It doesn't matter if you go to a Black doctor or not. Honestly, it really
Mm,
doesn't. I mean, it doesn't matter. It's the what matters is that the common denominator is that you are a Black woman and you are going to a doctor. Those are the two common denominators, and the result is very different. The outcome of those visits
well,
are often different than when someone else goes to a doctor.
well, and I
That's
agree.
the issue.
Yeah, I agree, Teresa, that when you go and make sure you understand you're your app you have to be your own advocate, and you go with the script. But in addition to that, you should be taking notes. You should be following up so that if there are things that maybe you didn't understand during the meeting with your physician, that you can follow up on. And I shared this previously. I am not a doctor. But when I go to the doctor and I get lab results, they tell you don't Google things, but let me tell you, I am looking everything up so that I can understand what this test was for. What does it mean if I'm in the range? What should I be concerned about? And I'm following up with my doctor. I'm sending questions, what did this mean? You didn't mention this, but I want to understand. And so we have to care enough about our own health that we become better advocates, and we become proactive in terms of making sure we're getting the best care. So
Okay. You let me tell you something, Lou.
mhm,
I respect what you said, but I'm stuck on the fact that I'm the CEO.
yeah,
And if this individual is working for me, I better not leave there without an understanding of what that number means,
oh no, I agree.
in accordance to my body.
No, I
In
agree,
accordance
but
to my body. Because when you Googling is a wonderful thing. Googling is a wonderful thing. But even in Googling, sometimes you have to put the picture together
yeah,
and it all works together. There might be a reason why one thing is high and one thing is low, and there's a perfectly good explanation. So
okay.
you really want to make sure that that doctor,
Well,
you talk to that with the doctor. Talk
and
about that with the doctor.
And that's not what I meant, but I know how you are when we get on these healthcare things. What I meant was certainly if
Lou,
you don't
Lou, come
understand,
on.
no, but certainly if you don't understand and you have the physician there, you're going to ask. But that's just like when I take my car into a mechanic and they're explaining something. When I get home, something, it may trigger something that I have another question. So then I follow up. That's what I'm saying. Not if you're in the discussion and you don't understand something. That's not the point. The point is after the discussion ends, when you go home and you think about something and it's like, oh, wait a minute. What did that, I thought about something that's connected to that. That's my point.
I,
That,
I hear you.
if you
Yeah.
don't, I'm not saying, and I don't want people to think I'm saying, because that's not even who I am. If you have a question, ask it then, of course. But in once you leave the appointment, if you get some other enlightenment or you have some other question, follow up. Teresa is so aggressive when it comes to healthcare. She is, but that's a good thing.
No, Lou, I don't. You take it. You're taking what I said personal. It wasn't.
It sounded
And
personal.
all the point that I'm trying to make, Lou, this thing is very serious. What's happening to Black women is very serious. And what I want people to understand, what I'm learning through all of this is that no longer, I mean, I've done it and I do it. I've gotten lab results and I've walked out of there without a question. Because guess what? I wasn't in the mindset of the fact that, hey, you work for me. You need to tell me what this means. I shouldn't have to go out on my own and try to figure it out, right? So I'm learning this, but it is a good point that those specialists shared with us about you are the CEO of your health, and you need to understand what's going, and you're paying those individuals to tell you, and if they can't do it, they're fired. They have to be. You can't trust them with something as precious as your life. It's just another structure that's put on us as Black women. And no,
but the point is that Teresa and I encourage you as always to be your own best advocate. It's unfortunate that when we're in pain or when we have concerns, we have to go and lay ourselves at the feet of professionals. But our hope is that this discussion today will in some way help us move forward to a better outcome relative to Black women, to our community, because it's to not do that is for us to fail here as we try to explore issues which impact us. So we wish you continued health and well-being as we move forward. Have a good day.